Draping for bilateral total knee replacement is an important first step. We use impervious disposable drapes. The first one comes on the table. You can see tourniquets have been applied and side support are being used. The second impervious drape comes on the torso of the patient, giving the first cover to the sterile zone. Then we take another drape deep to the legs on the table, pull it in between both the legs which have already been cleaned and painted and held by a assistant. These are clipped on both the sides. Once this is done, both the knees are now in a sterile isolated zone. We take another sheet on the torso and then pull it in between the legs again, as was done from the lower side. This gives us the second encirclage and protection. Once we clip this, we take the next sheet on the torso, which is taken ahead as the first screen. Now we are using a double O drape, which is specially made for bilateral total knee replacements. It has arrows to show you where is the top and the bottom, and then you hold both the feet and get the O onto the legs. It has an elastic band in the circle for the leg which grips the thigh very well. So this is a large drape now which covers the whole patient very well, and the proximal part is taken as a second drape. The final spirit and dry before we do the surface marking. That's the tibial tuberosity. We palpate the shin of the leg, make a few points on it. Connect these points as a straight line and continue it over the foot to reach the second toe. This line gives us a very good reference for our tibial jig. Then we mark the patella. Mind, all this is being done in the position that we are going to do the surgery, in which the knee is around 90 degrees. We palpate the tibial joint line, mark it, and then give our incision surface marking and make perpendicular lines to it, which help us in suturing when we are doing the closure. Once the surface marking is complete, we again seal the area of the surgery with adhesive drapes which have iodophore inside. One of the commercial names is Ioban. We use two of them. The top one is from the top and the lower one is from the downside, so that it wraps the whole leg. The foot is also covered inside this adhesive drape, making it totally draped. Now we are going to operate the right side, so we will cover the left lower limb with an impervious drape. Before starting the surgery, we need to exsanguinate the limb before we inflate the tourniquet. So we get the first wrap of a bandage from the toe till the proximal most level, and over which we use the sterile edge mark bandage. The edge mark bandage is taken around the foot once or twice to get a grip. After that, you start the squeezing process, in which you pull, encircle, again pull, encircle. This way you are gradually exsanguinating the whole limb of its blood. This continues till the proximal most part, and then we flex the knee to 90 degrees and inflate the tourniquet. Once this is done, the edge mark bandage and the cotton bandage both are taken off, and we are almost prepared for the surgery to begin. So that's the surface mark, and we are using the foot support and a side support so that the limb is supported.